Welcome to Prevention Empowers Me, a new program designed to help you become a health champion. I'm Jacqueline Bowens, Chief Executive Officer of the District of Columbia Primary Care Association. The DC Primary Care Association is committed to ensuring that all DC residents have the tools to achieve health and wellness through a quality health system that is equitable, easy to navigate, and empowering. The Prevention Empowers Me tagline is, "A healthy tomorrow starts today." So why don't we get started? With me today, representing the DC Department of Health, is the Senior Deputy Director of Community Health Administration, Mr. Ryan Springer. Mr. Springer is here to give us a DC health checkup. The Department of Health, under the leadership of Dr. Joxel Garcia, has initiated numerous innovative public health measures to improve and protect the health of all DC residents. Dr. Garcia's priorities include national health accreditation for the district, reduction in infant mortality rates, reducing health disparities, and establishing DC as the premier destination for research, training, and medical tourism by the year 2015. Welcome, Mr. Springer.
Thank you for having me. Pleasure being here.
We're so glad to have you here. We've all seen the statistics as it relates to Washington, D.C., and unfortunately, they portray a picture that shows some signs for improvement. So how would you and the department rate the health of D.C.?
Sure. And so, although there's always room for improvement, I'd like to highlight a couple, of the wins that we've had in the district. And, we couldn't do this without our partners in the community, families, as well as our provider stakeholders. But I'd like to acknowledge a couple of things. And first of all, the district is second in the nation in terms of insurance coverage, healthcare coverage, which we know is a huge impact on access to care. And so I think that's a huge step in the right direction going forward. And also, we've had steady reductions in our HIV diagnoses and mortality rates over the years, and that's been consistent for a number of years now as well. And we've also invested $90 million plus in renovations of hospitals and community sites as well. So we've probably expanded, I think, 9 various provider sites, as well as 7 new sites or refurbishing of those sites. And we also have decreases across the board on obesity and hypertension in the district as well. And so those are some wins that we have. And although there's successes, we know that there's still some room for improvement going forward. Mm-hmm. And so what we want to focus on going forward is looking at the disparities now in care. And so we have these key programs, but we want to look at the disparities across the community. And so with that, we are going to be setting up an Office of Health Equity, which would be focusing on that area as well. And we want to be more targeted in identifying those areas and those individuals who are most at risk so that we can have a response to those targeted groups. And we will be focusing on the social determinants of health so we can get at poverty, employment, et cetera. And so we're taking a broad scope to try to reduce even further these wins that we have. So that's what we're working on going forward.
And I really appreciate hearing your emphasis on social determinants, because I think we can never really underestimate those barriers, those obstacles to care. And we're all excited, and DC, as you mentioned, certainly leads the nation, second in the nation as it relates to health coverage. And the great thing about that is, we got there before healthcare reform. So certainly kudos to you. But as you mentioned, we do have opportunities for improvement and more things that we can do in terms of moving the needle forward. So let's talk a minute about infant mortality. We know those numbers probably aren't where we'd like them to be. Let's talk a little bit about what the department is doing in that regard.
Sure, I appreciate it. Get into that actually. And and I have to acknowledge the wins that we have so far. The district has been able to reduce its infant mortality rate by over 50% over the last two decades. And so that rate has come from, I think, 21 back in the 1990s down to 7.4 in 2011. And so that's a huge success. But even in looking at that, going back to the disparities now, as we look at the disparity between African American women and white women in the district, we've still got a disparity of about 8 points or so. And so what we're looking at now is, although we've had these wins and we've come so far, we want to take it to the next step. And I think that speaks to looking at eliminating those disparities between the African American and white population so that we can bring better health to our women and to the kids going forward. So we are working on several campaign efforts and programming elements with our community partners so that we can reduce that rate even more. We're looking to try to hit that goal of the 2020 Healthy People target of 5.0 by 2020. So.
Well, let's talk a little bit about this whole issue around, equitable distribution of services, and there often are concerns, particularly around certain communities in Washington, D.C.
Yep.
We hear a lot about, poverty in wards 7 and 8 and the
Yep.
lack of available resources. Do you all have any particularly targeted activities as it relates to wards 7 and 8?
Oh, absolutely. And so even specifically on infant mortality, with our programming going forward, we're targeting some of those areas. But I'd like to even highlight across this disparity conversation, we're seeing that even outside of those key wards, African American women who are living in other areas of the district are still experiencing high disparities, regardless of the geography of where they live. And I thought that was an interesting nuance of the data, but it also speaks to what is it about the social determinants around our African American women that we need to hone in on and focus on. And of course, then going into chronic disease and some of our other issues, we do have several targeted initiatives in those areas. Our Healthy Start program on infant mortality, again, is focused on 5, 7, and 8. And so we do, for those high-risk women, we provide home visitation services to them as well. So we do target based on geography and other demographic indicators that we come up with.
Can I stick with that for a minute because it also makes me want to ask about and seek some additional information as relates to our Latino population, very
Yes.
much a growing population in our community. And so I'd be interested to hear a little bit about any targeted initiatives as it relates to the Latino population.
Absolutely. Of course, we have our language access helpline that we use. We of course use our materials and convert them to whatever language we're dealing with, whether it's Spanish or otherwise. But we also, and again, back to infant mortality, keep going back to that. We've done a lot of data crunching around that. And we have seen that there's been an increase in the IMR rate for a Latino population. And so we're looking at that closely. And specifically in this new program, the new program activities going forward, we want to focus and look at what are those disparities causing the increases there. So we're looking at that as well.
Yeah. Well, I'm certainly excited to hear about that, and I appreciate that, and really excited to know that we have targeted areas of focus regarding our entire population. And while we've spoken to the African American Latino population, I'm really excited to have looked at some of your literature that you really are looking at the entire community, and so really excited about that.
And we'll be doing an even a better job once we have this Office of Health Equity up and running.
That's
the intent there is that we can look at any area in health where there's some kind of inequity, whether it's race or culturally based, that we can take a look at what those issues are and how can we have a targeted intervention. So yeah, we're looking forward to that.
Well, that's great. Well, we are in year 4 since the passage of the Affordable Care Act. For most people who kind of see it as health care reform. So can you talk a little bit about the department's efforts as it relates to a focus on chronic care conditions, and how has the Affordable Care Act and health reform really played a part in better facilitating the department to really focus in on some of those conditions?
And I think, the good thing about the work that's been going on at DOH, we've always had a targeted approach in the community, looking at, engaging and educating our community members on their health and taking ownership of their health. And so with the Affordable Care Act, the focus on prevention and wellness, we've already been engaged in that. But now that we have even better coverage across the district, and we've been doing that, prior, as you mentioned, to ACA, what we're working on is trying to educate our community members to get them back to their primary care physicians so that they can then access those prevention services. With the kind of coverage that we have, and I think I'm talking about 98% for adults, I think it's 100% over 65 and older. And with that, even the basic insurance coverage includes prevention and wellness care. And so the more work we can do in educating them so they have more information about how to take care of themselves and self-management, but also getting back to their health home so that they can continue their services there. And that's been the focus of what we have going on. And there's several initiatives around screening. There's a chronic disease management course that we have ongoing to engage folks and teach them about their chronic disease management tools. So there's a lot of activities in that way, but we want to make sure folks are going back to their primary care home.
So how are you all working across agencies? I mean, how do we, we meet the patients where they are? And so, many of our patients, if they're, working with the Department of Health. They're also working with Medicaid. They're also working with Human Services. So how are we meeting the patients where they are to really eliminate, we've got those social determinant barriers, but sometimes, we through our various programs or government, we can represent barriers as well.
Absolutely.
So how are we really streamlining processes to ensure that, we are meeting patients where they are, which for all of us are kind of lead the way toward better outcomes for our patients?
Absolutely. Good point. And this is a big issue for Dr. Garcia, a big interest of his, really. And so you spend a lot of time, engaging our other agency partners. We all collaborate on various committees and groups. And even with the infant mortality component, we're looking at, in this structure of what we're developing, we're looking at systems integration components that would be best practice that wouldn't just, be appropriate for our infant mortality work, but across all of our community health conditions. So that those partners that we need at the table are already engaged. And we're looking at how do we remove any kind of policy barriers and legislative barriers and systems barriers across agencies. And so I'm hoping that the work that we do there with this new program going forward, that'll be, sufficient for us to even push some of the other activities forward even more with our other partners.
Are there any other programs that are being launched by the department that really are, you want to kind of tell us a little bit about really exciting programs that are really making a difference and moving the needle that we often say? Any key things going on there?
There's several activities going on. The infant mortality being the largest initiative that we're working on now, but we have several around the Healthy Hearts Initiative, which is a national initiative that we're working on.
And we're an excited partner to be working with you on that.
Absolutely.
Great program.
We also have the Hair, Heart, and Health program going on under a chronic disease group as well. We have some asthma initiatives in the city, working with public housing units as well, trying to, how do we engage our communities around reducing smoking in the public housing. So we have several initiatives going on in that regard. Our immunization campaign, as we're going to back to school, we have several activities happening there as well, trying to get those kids vaccinated. Actually, we were just listed, we were ranked second in the nation by the National Immunization Study, the teen edition, and for our coverage rates for HPV for the male vaccine across several indicators. So that was a recent, piece of information that came out. So there's a lot happening. We're busy over at DOH.
Oh yes, I certainly have no doubt. Yep. The main topic of what we're here to talk about today is about prevention empowers me, and so I'm curious to hear from you. What do you all see, or what are you working on as it relates to, achieving full patient engagement and really signaling that sense of empowerment to our community that they can play a role in taking charge of their own health?
Yep. It's funny you bring that up. There's a quote that I use from a mentor of mine who says, "The community is the answer. What's the question?" And I've taken that with me every job that I've had, every professional role. And so, the team, at least within Community Health Administration, we've been talking about this. And so we're looking for opportunities to really engage our communities in a strong way. We have several, advisory groups, community groups, and we're looking at how can we, and of course everybody's tired of being on a million different groups, and so we're looking at how can we pull that together in a unified way where our community partners have a direct say and voice to the leadership of Community Health Administration. And of course, any strategic work that we're doing and planning work that we do, we'd like to engage our community partners in that way as well, so they can see it, review it, give us feedback, get back to us on it. So there's that relationship that we're looking at. And also, we're looking at starting to make some rounds around the community to really highlight the information that we're seeing. We've had several community needs assessments done, and so we want to go back to the community partners and say, okay, this is the information that we've seen. These are the program activities that we have going on, and this is how we like to partner. And I think, again, the answer is in the community, and they are our biggest partner in these activities.
Oh, well, we often hear the response, government isn't the solution. You often hear government is the solution. So how, and certainly I appreciated hearing your talk about partners, but how do we begin to kind of mobilize these health champions? And whether you're government, you're nonprofit, or your Vernita, who we heard, we've heard out in the community as a community health worker, doing great things. How do we really mobilize everyone as a team around moving that needle in empowerment? I'd be very curious about your thoughts there.
That's a good question. You know, my opinion on that is that we really have to be targeted in our approach. And so we need to be clear on the priorities that we have. And of course, as you've seen, as you listed, the director's laid out some clear priorities that are of interest to him. And so I think going to the community and expressing, okay, this is the information that we've seen, the data that we've seen around these targeted areas, getting their feedback. We need, the resources are there. The community partners are existing in various coalitions and other groups. And so how can we all bring our resources to bear on these particular targeted areas? And not that they're only around the director's priorities, but his priorities are based on what we're seeing in the community as well, but making sure those two align nicely. And then focusing our resources there. This is about collaborating with our other agencies, as you mentioned, DBH. I'm formerly from Department of Behavioral Health, and so I think there are lots of opportunities for collaboration there as well with their prevention centers in the community. So I think the resources are already there. It's how do we mobilize around targeted goals and priorities that we're working towards.
And what about sustainability? I mean, that's, you know, we see funding come for programs and great things happen, and we're real excited about that. But what about sustainability? The director has a number of priorities here.
Yes.
We implement them, but how do we sustain them?
Yes, and I think that's partly why the community is the answer, because there are limitations at the government level. But I think if we're all on the same page on the priority and the topic area that we're working towards, we build our infrastructure around that. And the priorities really are pretty solid. We look at the leading causes of death. Within CHA, we've taken a look at those along with the director's priorities, and those are the things to me that we need to move the needle on. Obesity is a huge issue. You know, 3 or so of the top 10 leading causes of death are related to obesity. And so we want to make sure that we focus our initiatives and activities there so that regardless of whomever the director is, the programs are in place, the community is already in place as a solid partner, that those activities continue.
Well, this is great. And I guess my last question I would ask you is, you know, what do you recommend to our community and to our residents so that they can take charge of their own health? Absolutely.
And I would say, you know, for our residents, definitely seek out your primary care physician if you have one. If you don't have one, definitely get connected with. Again, access is not a problem in terms of insurance coverage, but we need folks to actually go and see that care. And know your stats, you know, go get tested, go get screened, know your numbers, and build a nice solid resource around you of peers, friends who can help support you in your overall health. You know, no smoking, you know, let's work on that obesity issue, but you need a support team around you. And so I'd definitely recommend moving in that direction.
Well, thank you so much, Mr. Springer. It's really been a pleasure to have you, and we thank you for joining our program and sharing the Department of Health's vision for a healthier DC. It clearly is the right prescription. We appreciate your support for Prevention Empowers Me. We look forward to working closely with you and the Department of Health to urge our residents to start their healthy tomorrow today.
Families come in all sizes and shapes. Sometimes your friends are your family by choice, or sometimes you're just stuck with Uncle Charles. But what we know is that you want to protect the people that are close to you. But the flu can unravel everything. Your flu vaccine protects you and your family. No matter what draws your family together, protect yourself, protect your family. Everyone needs a flu vaccine.
Listen up. Each year, hundreds of promising research studies go unfunded for breast cancer, for lung cancer, every cancer. The American Cancer Society has been behind nearly every breakthrough in recent history. But there's still more work to do. So let's make sure that no research is silenced. Let's make noise. Let's make noise. Yeah. And let's finish the fight.
Building health champions and a healthier DC takes time. We know that wellness does not happen overnight, but the DC Primary Care Association has a prescription for DC's health that's good medicine for everyone. Through a Community Transformation Grant Award, we aim to help you manage your type 2 diabetes, heart disease, stroke risk, and asthma, as well as providing tips on stroke prevention. The program is called Prevention Empowers Me. Our goal is to enhance the efforts of community health workers to support chronic disease prevention, address barriers to community health workers in reaching our most vulnerable populations, and increase the use of chronic disease prevention and self-management programs at community sites. With me today is Fernanda Azucena, the Prevention Empowers Me Program Coordinator for the DC Primary Care Association, and Courtney Coffey with the Institute for Public Health Innovation, the evaluation partner of our new program, Prevention Empowers Me.
Thank you for having us.
Thank you.
Thank you. I'm happy to have you here with us this morning. Fernanda, can you tell me a little bit about how the Prevention Empowers Me program is unique to the District of Columbia and how it may be tailored directly to our residents?
Sure. So our approach was to identify the wards in the city that had the highest incidence of diabetes, heart disease, asthma, and stroke. And we took that information through a scan and figured out that wards 1, 4, 5, 6, 7, and 8 really needed a lot more education on some self-management. And self-management is just knowing about your disease and being able to do the things on a daily basis to keep it controlled. And so we figured that by reaching these communities, that we would really tailor our program to the most neediest. And so we really figured out that the African American population and the Latino population in this city really needed these services. And using the community health workers, we're able to reach them either through a group setting or a one-on-one at some non-traditional community sites. And so that's how we were able to figure out where to give our trainings and who is going to work with us on this partnership.
So let me ask you, is it the community health workers that really distinguish this program from other programs that have been launched in the past?
Yes. So in our efforts to build a community health worker workforce and to integrate them into primary care, we've really taken the approach that the community health worker is the primary point of contact, because these are people that work, play, and live in these communities that are familiar with what's going on, and people are more willing to come talk to them about some of these issues rather than the provider. So it is a really unique approach in using community health workers. And so training them, they will go ahead and disseminate the information.
Well, I mean, that sounds wonderful, and we're really excited to continue to learn a lot more about how the program works, particularly its utilization of the community health workers. So, Courtney, let me ask you a question. We all know that evaluation really is a critical component of any successful initiative. So talk to us a little bit about the evaluation tool for community in the Empowers Me program.
Okay, great. Well, thank you. The evaluation portion of Prevention Empowers Me is really in two parts. The first part is an environmental scan. We wanted to see what is the current landscape of community health workers, as well as what skill sets do they have, what organizations utilize them, and specifically with our partner sites that are receiving the training, how does that training fall in line with their own mission, and how do they move those pieces forward? So we conducted 3 assessments. One was a community health worker survey. One was a organizational scan, which was really a lot of our partner sites and a lot of our sites that interact with DCPCA that either utilize community health workers right now, are in the process of doing it, or are interested in community health workers. And finally, the last piece of it is a gaps analysis interview, where we looked at the strengths, the weaknesses, as well as opportunities for transformation for those sites that are receiving training. And then the second piece looks at more of the training. We created pre and post tests for each of the modules that covers chronic disease. There is a wellness module, a diabetes module, as well as a heart disease module, and finally wrapping up with an asthma module. And so we're looking at the CHW's ability to retain the content and information. And then we're going to follow up with doing focus groups with the community health workers as well as with their partner sites to see how are they actually applying this new knowledge out in the community, as well as who is really being reached.
Oh, wonderful. And so I guess we've got the toolkit, we've got the evaluation, and so we clearly are going along a positive path. So let me ask both of you this question. So as we look forward to taking into consideration the information we have, what opportunities are there for us moving forward based on the findings thus far? So I'd like to hear from both of you.
Mm-hmm. So one of the biggest pushes of our program is really to start talking about sustainability and our ability to keep these efforts up even when the money is gone. And so what we really hope to do is to start building that through this ad campaign that you may have seen on the metro, on the buses that run through certain wards, as well as doing this spot on television, and then as well as kind of just following up with some of the community health workers that we've trained to gauge their experience with the materials, with the trainings, and if they have moved forward in using the materials that were provided to them. And so our big push is really to sustain these efforts even when we don't have the major funding behind them.
Mm-hmm. Courtney, would you like to add a comment?
Sure. From our aspect in our written report, we will definitely provide recommendations both to the CDC as well as DCPCA, especially as DCPCA tries to maybe go after additional funding, really in terms of talking with the sites about the training and sort of what they hope to utilize afterwards. It's really ongoing training. They want the ability for the CHWs to have continuing education on these topics. Because, 4 modules just really isn't enough. And a lot of our community health workers are working in one disease-specific focus, but now they're learning how comorbidities can also affect one another, and giving the CHW an opportunity to continue to learn and grow in that aspect. And then also for our sites, we realize that in terms of sustainability, funding is also a concern. Most of our sites really only have maybe 1 to 3 years of funding to keep their CHWs on. So another thing that recommendation that we would love to provide to the CDC is to really provide some long-term established funding for agencies that want to utilize CHWs and keep them on for the long term.
This is great. So I would again want to thank both of you, Fernanda and Courtney, for joining me today to discuss the Prevention Empowers Me program. This is an exciting and innovative program that empowers our community to take charge of their own health, which is the best prescription for becoming a health champion. We look forward to working closely with you to urge our residents to start their healthy tomorrow today. Let's all be health champions together.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just please, don't leave.
Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
When I have an asthma attack, I feel scared. Sometimes my parents have to take me to the hospital. I feel like a fish with no water.
You know how to react to their asthma attacks. Here's how to prevent them. Visit www.noattacks.org or call your doctor. Because even one attack is one too many.
Prevention Empowers Me is a prescription for DC's health, but we can't move the needle on progress without our healthcare partners. Through community collaboration, Prevention Empowers Me aims to empower all DC residents to become health champions. Our goal is to prevent chronic illnesses like type 2 diabetes, heart disease, asthma, and to find ways to prevent and detect strokes. With me today are Prevention Empowers Me partners who are standing ready to help our community start their healthy tomorrow today. Dr. Tilly Williams, better known as Dr. Tilly, works through Total Lifestyle Change Incorporated, a nonprofit group founded by Dr. Lenore Coleman. Total Lifestyle Change is dedicated to eliminating health disparities in minority and at-risk populations in our community. Elsa Romero works with the Community Health Worker Association of Washington, D.C. She's the vice president of the association and a passionate activist for building a stronger healthcare workforce for community health workers. Welcome, panel, and thanks for joining us.
Thank you.
We're so happy to have you very much. I'd like to start off with a couple of questions, and both of you, I'd like you to answer those for me. Both your organizations utilize community health workers. Tell us a little bit about how community health workers are really making a difference in moving the needle.
Well, I can speak about our program. We had a diabetes navigation program of Total Lifestyle Change. And we use community health workers to go out into the community to do assessments in terms of glucose levels, hemoglobin A1C, blood pressure, getting all of the vitals for our patients. And they have been really like a link from the doctors, let's say, to the patients. They tell the community health workers so much more. They open up, and it's been really a really good partnership by using the community health workers in our program.
And Elsa, certainly as a community health worker yourself, maybe you can talk a little bit and share with us your experience.
Well, about the association, we are building a beautiful association, professional association, because we need to give the skills that they need. We are a unique workforce, and we have to give and work united to expand this new role that is work with the community. And we are social determinants, and as the doctor said, we are the bridge between providers and the community. At the association, we are really aspect of the different ethnicities. For example, I am a Spanish speaker, and I'm sorry for the accent. And we have all the communities. So because we are from the community, and we have the power to give the skills and everything our communities need to take care of the health and better know the disease or the chronic condition they got. For example, diabetes, as the doctor said, or heart disease, or asthma. So it's really, really fascinating.
That's wonderful. And I guess I have a second question. Clearly, community health workers are of and from the community. So how do we get the members of the community to actually become interested in becoming a community health worker? That's the first part of my question. And the second part of it is once we have them within our network, what are the professional development opportunities that exist to really keep them engaged and fully operational and involved really in our Empowers Me program?
Well, I've actually found that when we call our community health workers wellness coaches.
Great.
And when they go out to talk to the community, oftentimes they are asked questions about how do I get to do what you're doing? And so there is a real interest. we do a lot of programming where we train them with the Prevention Empowers Me. We were able to train our wellness coaches, and then they train the community residents. We talk to them about what's possible and the programs. We happen to use medical assistants within our program and train them to be the wellness coaches. I think there are all kinds of opportunities based on the interest, and especially based on the community involvement of the residents. They want to do more. Right. They want to support the community. They want to know more to help each other and support each other.
And clearly, I was just wanting to add, and clearly the community health workers, I can't think of a better way to really demonstrate empowerment other than using those from the community that are for the community and within the community to really set great examples about empowerment. And so we'd love to hear your thoughts.
As a community health worker, working in my case, a Hispanic community, we try to, we are the same, so we are trying to better place them in the community. The fact they became more integrated to the community, and they see our happiness and our empowerment, our enthusiasm to work. And when they know what's going on with diabetes, why the glucose can be higher, so they start learning, and because it's not complicated, it's a way to be, so they want to become community health workers. So we start little leadership, the way we can give them all the tools and skills they needed. So at the association, we work with the community health workers, the way we can train together and have a level to grow up together and with the community.
That's fantastic. Let's talk a little bit about partnerships and collaboration. I'd be interested to hear from both of you. You know, let's talk a little bit. How important are those partnerships and collaborations? Have you really seen great progress and a difference truly being made when you're working in concert with others as we think about that prescription for health and moving that needle forward? So I'd be very interested to hear a little bit about that.
Well, yeah, I can share that with you. Originally, with Total Lifestyle Change, we focused on diabetes. Now, of course, with diabetes, there's so many other comorbidities, and so when we received a grant the next year, well, in 2014, this year rather, we were able to deal more with not only with diabetes, but with the comorbidities too. So what did that mean? We needed to train our community health workers, our wellness coaches on heart disease, stroke, asthma. So along comes DCPCA, you know, and Prevention Empowers Me, and you guys came through and helped us with the training. That training made a difference because when you go out to speak to the community residents, they don't come packaged with just diabetes. There are all kinds of things going on. And so with that knowledge, they were able to, the wellness coaches were able to talk to them and give them some coaching in terms of how to eat for certain things, where to seek other help and support for heart disease. You know, so that collaboration made a huge difference in addition to the ones we have with some of the clinics around the city, other associations within the community. It makes all the difference in the world. We could not operate without our partners and the collaboration that we have within the healthcare organization in DC.
And that's truly reflective of the spirit that we have at DCPCA, and so clearly those partnerships are exciting to us as well. And so, Elsa, tell me a little bit about your experience.
Well, for us, DCPCA was and is and will be a tremendous help because they help us to grow up. They host us. They give us tools to grow up as an association, and also gave us opportunities to go to another places, know and be with others, community health workers and association. So this BCA for us is very important.
Yeah. Yeah, and it's great. I mean, this really is about the toolkit, and
yes.
so your examples are really wonderful as we think about how we've been able to use the Empowers Me toolkit to really move that needle. And I guess I'd like to maybe follow up with one last question, and that's really about your thoughts about sustainability. Tell me a little bit about your ideas and thoughts about as we continue down this path of empowerment and patient engagement. Tell us a little bit your thoughts about sustainability.
Well, number one, sustainability is just most important now with funding levels decreasing, and we have to be creative about how we go out and continue to do the work we do, and sometimes have to do it with less funds. So I particularly like the trainers, because once you put this knowledge in the hands and the heads of the community, they take it on.
That's right.
They will take it on, and just with a little bit of motivation, inspiration, and not necessarily as much money, because they aren't looking for money. They're looking for the opportunity to be support to their friends and family. So when that information is passed on, then I find that gives us a level of sustainability, and keeps the program, keeps the information moving. We play it forward.
That's right.
Pretty much.
Elsa, any last remarks?
Yeah, I think since we can develop new models following these little essential things, I think it's gonna move everyone or motivate to be, how can I say, more engaged.
Yeah.
That was the, thank you, engaged. And they can give us more value that and then that can flow by itself.
Well, again, let me thank you very much for both of you, Dr. Tilley and Elsa Romero, for working with us as partners in our common goal to create healthier and therefore happier residents of the District of Columbia. Your help is critical in filling the prescription for DC's health, so we can all be health champions together.
But why should I get tested for colon cancer? I don't have any symptoms.
Of cancers affecting both men and women, colorectal cancer is the second leading cancer killer in the United States. And it doesn't always cause symptoms, especially early on.
But I'm only 53. I'm too young.
Screening is recommended for men and women beginning at 50.
But no one in my family had colon cancer. It doesn't run in my family.
Most colorectal cancers occur in people with no family history of the disease.
But that test...
There are several kinds of screening tests for colorectal cancer. Talk to your doctor about which one is right for you.
I've been screened, and it turned out I had polyps. And the doctor removed them before they had a chance to turn into cancer.
No buts about it. This is one cancer you can prevent. If you're 50 or older, talk to your doctor and get screened for colorectal cancer. Screening saves lives.
Community health workers are on the front lines of DC's ongoing crusade to help DC residents become health champions and empower them to take charge of their health. If we believe in our slogan that a healthy tomorrow starts today, then we must rely on those most connected to the communities as neighbors, partners, and friends, the community health workers, to achieve that goal. Prevention Empowers Me is providing toolkits to give these frontline workers the best training and self-management tools to help get our Healthier DC message across. With me today are a few of the community health workers participating in Prevention Empowers Me. They are just what the doctor ordered for a healthier DC. Vernita Perry works through the Positive Pathways program. She's been an advocate for HIV patients for more than 10 years and is a member of the Community Health Workers Professional Association. Chanel Gaydon works through the Capital Clinical Integrated Network. She is a passionate health educator who recently participated in our training provides. Leslie Demas, a community health worker from the Positive Pathways program. He is a staunch advocate for the professional development of community health workers. Welcome, panel.
Thank you. So happy to be here.
Well, we're great to have you as well. Let me say, you guys, you're on the front lines. You really, truly are the boots on the ground. In a nutshell, can you tell us a little bit about what the obstacles you face in serving and really working with some of our communities here in the district, particularly as it relates to their health?
I would say it's a building of bridges with the families to connect them to the resources that they need and to also educate them to the resources, to get them adequately and to allow them to be able to share it with their families and friends. We find many cases where it's families who share this resource with other neighbors, and so I'm introduced to other families through those families, and I'm finding myself educating the community, going into one home, then that's transpired to several other homes. So it's basically, I would say, sharing the resources in the community.
Any thoughts?
Well, as for me, like she said, with the family, you know, when you go see the client and then the family is there, like the mothers or the brothers and sisters, then maybe the girlfriends or the boyfriend, they don't have the resources, so they share with each other. Matter of fact, I end up giving it to the next person, and they're not even my client. So it's just going from one person to the next when you're working into the community.
Well, we're here to talk about Prevention Empowers Me. And one of the essential components of the Prevention Empowers Me program is the toolkit. So let's talk a little bit about how that toolkit has been helpful to your work and really being on the front lines and working with the community.
Well, it's basically tailored to the community health worker. So it's very, the information it provides is support for us, but also the families. So once we share this kit with the families, it's very easy to explain. It is basically created, I think, it's a lot of information, but they made it to where the family can be engaged. So I would say it does help with engaging the families with the images from the stories and the recipes and just some of the real life scenarios that some of our families face.
And I like the toolkit. I like the toolkit for myself, for real. So I believe living by example. So, and actually when we was first given the toolkit, I was amazed at it because first of all, it's the education level of where you meet a person where they at. You know what I'm saying? It don't have the big words and that people normally don't understand. If you're not in college or old, you can't understand big words. You know what I'm saying? So the pictures, I like the pictures, I like the recipes, and it's just easy to explain what we need to do to better our health. And so I really use it for myself also.
That's wonderful.
Toolkit, very illustrative. You know, when they presented it to us, we looked at it as being overabundance. But as we started going through the toolkit, we found it to be one of the most essential tools that we could use in our work. Matter of fact, we've kind of built a whole curriculum around it at my organization. So it's been a great resource. It really has.
You know, we really depend on you all as community health workers, as I said earlier, to really be on the front lines and be those true boots on the grounds and making a difference. Do you really feel as if you're equipped with all the proper tools? You know, it's one thing certainly to kind of gain that credibility to kind of be present and be engaged, but do you feel like you really have the tools that are really helping us move the needle in terms of better prevention and better outcomes for our community?
I believe we do because, well, I started with Positive Pathways in 2011, and that's like the pilot of Positive Pathways. So we went through Community College of DC, Columbia, DC, for 8 months, and then we get continued training every month. You know what I'm saying? So as new information come in, we get it almost immediately. You know what I'm saying? If we have a problem or we feel like we have obstacles coming before us, we bring it to our training, and so that we can get training on, so we can be able to tackle these obstacles better. I have gotten a lot of people into healthcare, so I think that we are equipped. It's never enough information, you know. So I believe we get better and better and better. It's almost natural to me. It's almost natural to me because I have a passion for what I do. If I can get just one person to go to the doctor, take their medication, look better, eat right and whatnot, I feel good about myself. I feel like I'm doing something. But if I couldn't get at least one person, then I feel like I'm not doing something right. So I believe we are equipped, very equipped. You know what I'm saying? They need us. Seriously, they do.
And we need you. We
Yeah.
need you. Leslie, what are your thoughts about that?
Really, Bernetta said it, that we have ongoing training. And like she said, if there's any obstacles that we face, and we mentioned it to the trainers, they'll provide the training for us. And this is an ongoing training for us. And you have to have a passion for this job. And far as I could see, most of the community workers that work for Positive Pathways have that passion. You know, we come together once a month and for our trainings. You know, all of us come together at Institute for Public Health Innovations, and we be together for a whole day. And whatever training that we feel that's necessary for us to better serve the community and our clients, they offer it. So, you know, as far as us having the tools, I think it shows in the work that we do.
I agree with both of my colleagues here, but I think that since we're constantly evolving, that more training is always necessary, more tools. We do such a hard work meeting new families and not understanding certain barriers and trying to be encouraging through the barriers and supporting them and providing them with the educational component as well as the social component, and just being real with them and being able to be trusted, able to go into the home and sit there just as if we were their family. So I think that trainings around changing the mindsets and encouraging behavior changes for healthy living is always needed. But I will say, being a community health worker thus far, I feel very supported.
Oh, that's fantastic. And that really leads me to another question is, so how are the communities really responding to your engagement and intervention? You know, how do they feel? I mean, do they feel that this is a valuable program? I'm excited to hear that you guys have the tools that you need and you're equipped. So, but how are the families, the communities really reacting to this Prevention Empowers Me program?
Some of the families and clients, they become dependent on us. You know what I'm saying? Because we doing things that no one else have, you know, like we go with them to their doctor's appointments. We explain to them their labs, you know, we give them the education, what they need to prevent. I work with HIV populations, so I give them the information to prevent, what you want to call it, prevent catching it, okay? And also to better take care of yourself. I'm there for emotional support. If you need someone to talk to, I'll sit there and listen to you, you know. I'm not gonna give up no advice unless, I mean, if I think, and I'm sure there's good advice, you know what I'm saying? I can't tell you what to do. I'll let you know what's best to do. You know, I have them where they call me all the time, even on the weekends. So they depend on us. And then when someone asks them about us, they give good reports of us. And that sounds so good when I hear that. They say, well, Miss Perry doing real good. I like Miss Perry. I need Miss Perry. And when it's time for us to release them, they do not want to be released. Yeah.
So the families and the community are very receptive of us, because we do make a difference. And as community health workers, we bring, can I say, an unusual sense of community, because we're from the community, so we kind of familiar. You know, that's what the community health worker comes from. So we come from out of the community, and we kind of have a bond there. You know, so when we're doing our job, we have that experience, and that experience gives us a certain bond with our clients and their families. So, you know, as we service our clients, a lot of times there's a lot of interaction with the families. So, you know, they become a part of the services that we provide. And what I found that as the community health worker, this position kind of opens up, you know, the community, they become very receptive of it, very, very much so.
Yeah, it's great to hear.
I agree. I think that we're received well. Like I say, we're trusted. I think that I found that a lot of families, once they come on a case, like she said, they don't want to roll off. They're like, what? No. And so then they'll share it with another family member so we can still stay connected. So I think it just continues to grow and move forward with the community with other families.
Well, all I can say is, you know, you guys are just wonderful examples of really what the power of one means in terms of making a difference, and, you know, not just boots on the ground, but really the heart and soul of our program. Prevention Empowers Me, and truly, truly great and wonderful examples of moving the needle forward. So I absolutely applaud you, and thank you so much for sharing with us today.
Thank you.
And thank you for having us.
And on behalf of the Primary Care Association and Prevention Empowers Me, again, thank you for your tireless service. Our goals are the same: a healthier DC. Let's continue to work together to create DC health champions, because a healthier tomorrow starts today.
Yes.
Thank you.
Thank you.
Thank you.
In 2011, the infant mortality rate in D.C. was 7.4 deaths per 1,000 live births, compared to the national rate of 6.1. Close to 14% of children in the district have asthma, 56% greater than the national average. 30% of all D.C. residents have hypertension, and that number increases to 40% for low-income residents in wards 7 and 8. Diabetes in the African American population is 14.2%, almost twice as high as the DC average of 8.2%. The need for primary health care is critical. That's where the DC Primary Care Association steps in. DCPCA, in partnership with their member health centers and the Department of Health, is committed to ensuring that all DC residents have the tools to achieve health and wellness. DCPCA works to make sure DC residents have access to a quality health system that is equitable, easy to navigate, and empowering. But we need your help. Get involved in your health. See our new program, Prevention Empowers Me, and contact DCPCA, because your healthy tomorrow starts today.